Hello, my name is Evelyn Durán Fernandez. My topic is about osteopetrosis and Enlermeyer Flask deformity. Definition: Osteopetrosis, also known as marble bone disease, Albrecht-Schomburg disease, is a rare disease of autosomal recessive inheritance that produces a diffuse and symmetrical sclerosis of the skeleton. White abnormally fragile bones although its appearance in stone-like. Enlermeyer Flask deformity refers to a radiographic appearance typically on femoral radiography, demonstrating relative constriction in the diaphysis and flaring or metaphysis.
Today I'm going to talk about radiological findings of osteopetrosis. Here this is 2 minutes radiology. I'm going to only discuss about the important points or catching points in USMLE that can help you to diagnose it correctly. Let's talk about. Okay, remember in osteopetrosis there is generalized increase in the bone density. The bone density is increased. Okay, and you can see bone within bone, bone within bone appearance. Okay, just Google the images, guys. I cannot put the images over here because of the copyright, so just you can put the images. Okay, then very important is, as we discussed before, Enlermeyer Flask deformity. Okay, Enlermeyer Flask deformity of the femur. Right, and another one is Ruger Jersey spine, very important. Okay, and you can see spondylolisthesis, okay guys, so thank you so much for watching this video. What are the causes for osteopetrosis? What are the radiological findings of osteopetrosis? The bone density, generalized bone density is raised, bone within a bone appearance, then Enlermeyer Flask deformity of the femur, Ruger Jersey spine, and spondylolisthesis. Thank you so much for watching.
Application in medicine. It is caused by failure of osteoclast differentiation and function and mutation in the legs. Then genes have been identified as causative in humans. Osteoclasts are highly specialized cells, which degrades bone mineral and organic bone matrix. These processes are crucial for bone remodeling and maintenance of bone biochemical stability and mineral homeostasis.
So here we have an image and the classical appearance. We see that this is a vertebra and we see a smaller vertebra within it. So we have a small vertebra and a larger vertebra. So this is the bone within bone appearance, which is seen in osteopetrosis. Osteopetrosis, the term itself means osteo means bone and petros means stone. So the bones in osteopetrosis are like stones, that is, they are sclerosed because osteoclasts are defective in osteopetrosis. This is a MCQ asked. In osteopetrosis, it is dysfunction of osteoclast and not osteoblast. That is why the bones are sclerosed. So this image shows all the features of osteopetrosis. We see that there is widening of the diploic space, especially the skull base. which leads to compression of the cranial nerves and hence symptoms like visual complaints and deafness. In the vertebra, you see this sandwich appearance, that is the end plate sclerosis, that is sandwich sign of osteopetrosis, again the sandwich sign. The bones are dense, diffuse osteosclerosis. The medullary cavity is also involved. That is why there is anemia, thrombocytopenia, and there is extramedullary hematopoiesis leading to hepatosplenomegaly. And we see bone within bone appearance here, and there is metaphyseal flaring, that is called Erlenmeyer Flask deformity seen in femur. So these are the features of osteopetrosis, which is also called Albers-Schönberg disease or marble bone disease.
Pros and cons. Acute bone disease, including primary bone marrow disorders, heavy metal poisoning, bone metabolic disease, and other dysplasias. Delineation between osteopetrosis and normal bone suggests a period of increased bone turnover followed by improved bone growth. This finding is more consistent by visual pains, exposure than weight and underlying genetic condition.
Alright, let's talk about osteopetrosis. Osteo means bone, petrosis refers to rock-like. So this is a disorder in which you have abnormally thick, heavy bones. It's an inherited defect in bone resorption. Now, if you remember, bone formation is a balance between osteoblasts, which lay on bone, and osteoclasts, which resorb bone. Now, this balance is constantly occurring throughout life so that you're always laying down some bone and always resorbing some bone. Now, a defect in bone resorption in which you're constantly laying down bone and laying down bone but can't resorb it results in an abnormally thick and heavy bone. Now, despite it being abnormally thick and heavy, it fractures easily. Think of it like a piece of chalk. A piece of chalk is thick, but you can easily crack it. Now, this disorder is due to poor osteoclast function. It has multiple genetic variants. Most important is the carbonic anhydrase 2 mutation, which results in a lack of acidic environment that's required for bone resorption. An acidic environment is necessary in order to remove calcium to resorb bone. Now, in order to generate an acidic environment, the enzyme carbonic anhydrase is necessary. Carbonic anhydrase combines water and CO2 to make up H2CO3. Carbonic acid then breaks up into a proton and bicarbonate. Now, this proton, which is the acid, leaves the cells, and this is what creates the acidic environment necessary for bone resorption. If osteoclasts don't have the ability to generate this acidic environment, they won't be able to resorb bone, and this is exactly what occurs in the carbonic anhydrase 2 mutation. The clinical features of osteopetrosis include bone fractures. Now remember, although the bone is thick, it's going to be very weak, hence it's more prone to fractures. And this is because there is no proper balance between the osteoclasts and osteoblasts. And in order to make strong bones, you need to have a balance between the osteoclasts and osteoblasts. Patients can also have anemia, thrombocytopenia, and leukopenia. So now this occurs because the thickening of the bone replaces the medullary space, which is called a myelophysic process. Myelophysic process which knocks out the ability for hematopoiesis. Hematopoiesis, which means generating blood cells. So if hematopoiesis is knocked out, individuals end up with anemia, low red blood cells, thrombocytopenia, low platelets, and leukopenia, low white blood cells. These individuals end up with extramedullary hematopoiesis, so this blood cells are going to be made outside of the bone marrow, either in
Kitsu athlete in Ecuador. In Ecuador, due to lack of instruments, exam and other methods to diagnose this disease, the prognosis of life is low. People have to go to another developed countries to pay for the proper exam to diagnose osteopetrosis, among other bone disease. A total of 10,000 consists of the genetic exam and control exam. 80 flow to the pharmacology treatment, which consists in 200 for 15 ml on calcitriol each day. This disease affects 1 out 2,000 people.
This is a young patient who presented with neck pain. Frontal and lateral radiographs of the cervical spine were obtained. These radiographs demonstrate no evidence of fracture or evidence of degenerative disease. However, the bones have a diffusely sclerotic appearance with thickening of the cortex. As part of this patient's workup, a third radiograph of the pelvis and proximal femurs were obtained. The third radiograph demonstrates diffuse sclerosis of the pelvis and proximal femurs. While the differential diagnosis for diffusely sclerotic bones is broad, this patient had a metabolic bone disease known as osteopetrosis. In osteopetrosis, there is malfunction of cells known as osteoclasts, which are responsible for bone resorption. The bones become too dense. However, the bones are also at risk of fracture and dissolution. Other complications include anemia, infection, and multiple cranial nerve palsy secondary to increased osseous expansion of many of the neural foramina of the skull base.
Osteopetrosis, represented by the osteopetrol. These are the patrol up here. They patrol the osteos. Osteos are bones. Here are the bones down here, and these helicopters patrol and make sure they're okay. So osteopetrol for osteopetrosis. So what's going on over here is that there's an osteoclast over here. The bones are having their class over here, and they want to get protected. This class, however, is going to be destroyed. It's going to explode. This is to help us remember that it is the defective osteoclasts which are responsible for osteopetrosis. More specifically, the defective osteoclasts, represented by the class exploding, leads to failure of normal bone resorption. Normally, osteoclasts break down bone, and since they're defective in osteopetrosis, the bones will not break down normally. Now, this might sound good, right? Don't we want to have thick bones? No. Thick, dense bones are not good because they're actually more prone to fracture. Now look at this helicopter over here. He drops some DNA, and the DNA explodes, and it causes the lemon to explode. So the DNA exploding refers to the mutations, specifically in carbonic anhydrase 2, which is inside osteoclasts, and this leads to the lemon exploding, which refers to the acidic environment. Normally, osteoclasts require an acidic environment to break down bone, but in this mutation of carbonic anhydrase 2, the acidic environment will not be made, and thus bone resorption cannot be done because the bone resorption relies on an acidic environment. So that is the pathophysiology of osteopetrosis. Let's talk now about the symptoms. So conveniently, this osteoclast is learning about osteopetrosis. As the teacher mentioned, osteopetrosis is failure of normal bone resorption due to defective osteoclasts, which leads to thick and dense bone that are prone to fracture. Okay, and due to the overgrowth of cortical bone that fills bone marrow space, there's going to be pancytopenia and extramedullary hematopoiesis. And due to the narrowed foramina, osteopetrosis can result in cranial nerve impingement, which can of course lead to palsies. On the board over here, the teacher stuck an X-ray picture of the diffuse symmetric sclerosis seen in osteopetrosis, which is basically bone in bone, and it's more whitish as you can see over here. Okay, just a word on treatment. So the only treatment really available that could potentially do anything is bone marrow transplant. This is potentially curative because osteoclasts are derived from monocytes. So the monocytes in the new bone marrow can
Conclusion. This condition varies greatly in their presentation as severity rating from neonatal ones with life-threatening complications such as bone marrow failure to the incidental finding of osteopetrosis on radiographs.
In this case, we have x-rays of the pelvis and the right hip. And you can see these are very old x-rays from our archives because this is a very unusual disease called osteopetrosis. It's also known as stone disease or marble bone disease. It's an extremely rare inherited disorder where the bones harden and becoming denser. So you can see that there's extreme remodeling and deformity of the bones, and they're really dense and sclerotic. And that's what you see in patients with osteopetrosis. But of course, in real life, you most likely are never going to see a case of this. The bones, even though they become sclerotic, they're less dense, so they're brittle, and they actually have osteomalacia, and they get soft. And so that's why you see the deformity as well as the sclerosis.